Hi, my name is Jasmine Solomon. I'm a public health professional and a graduate of the University of New England. Today I'm going to be presenting you the Pinellas County Community Assessment. I chose to assess Pinellas County because I live and work in Pinellas County, and I find that a community assessment is very helpful in learning the demographic of your county and finding the health problems and resolutions based on the resources that are available. In this assessment, I'm going to tell you the overview of the county, a description of the demographic, the health profile, health concerns, assets available, and some resolutions to the problems. Pinellas County is a 280 square mile county that is located on the west coast of the state of Florida in the center area, and it has a population of over 900,000. It's the sixth most populated county in the state of Florida, and there's 3,300 people each square mile, which makes it by far the most densely populated county in the state of Florida. 52% of the residents of Pinellas County are female, followed by 48% male. The median age in the county is 46 years old, and the county is mostly white at 82%, 10% black, 3% Asian, and the rest are Pacific Islanders. The graduation rate in Pinellas County is 91%. This is significantly higher than the state of Florida graduation rate of 87%. There's also 30% of the county that has bachelor's degrees. The median income of the county is $48,968. The median home value is $167,100. This has changed and it continues to rise currently. In the assessment of Pinellas County, I did a windshield assessment. Driving around the county, I found that there are many large homes bordering the county on the waterfront areas, and inland you can find rundown, dilapidated homes and a lot of mobile home parks. Pinellas County has a very diverse socioeconomic level. There are 5 areas of the county that are considered high-risk zones. Those 5 areas include East Tarpon Springs, North Greenwood, High Point, Lauman Corridor, and South St. Petersburg. In those 5 areas, you will find that there is a misuse of resources. There are many that are needing education and food that are not available to them in their area, and there's a higher rate of homeless in those areas. Pinellas County is ranked 25th out of 67 counties in the state of Florida for overall health outcomes. Currently, the largest epidemic in Pinellas County is hepatitis A. Hepatitis A is spreading quickly in Pinellas County. It's more than doubled in the last year, and it continues to be on the rise. The cause of this is the population density. The population density in Pinellas County is very high, and the homeless population is very high. The homeless population tends to carry more hepatitis A and spread hepatitis A rapidly due to lack of cleanliness. Hepatitis A is spread through fecal matter and is often prevented through hand washing. Another health concern that was brought to my attention by the health leaders in Pinellas County through interview is infant deaths. There are many infant deaths in Pinellas County that result from suffocation. This is a problem that is currently being worked on by many public health agents in Pinellas County by outreaching to the community. Infant deaths is a concern. Another concern in Pinellas County is unintentional injury death. This is the leading preventable cause of death in Pinellas County currently. Unintentional injury death is on the rise in the state of Florida. It was the 3rd and 4th leading cause of death in the county in the last few years. Unintentional injury includes many factors. One of the top factors is motor vehicle collisions. Pinellas County has a 3-year average of over 18,000 traffic crashes, resulting in over 117 fatalities. The state average is over 400,000 crashes each year. Many of these crashes happen in Pinellas County. On average, 1 minor in Pinellas County is arrested for auto theft each day. Auto theft raises the rate of traffic crashes. The rise in auto theft has created a problem in Pinellas County. There has been a significant increase in teen fatalities due to auto theft in Pinellas County. There are more than 2,000 auto thefts in Pinellas County every single year. On average, there are 77 crashes per day in Pinellas County. On average, there are more than 18,000 vehicle crashes in Pinellas County, with 117 resulting in fatalities. Pinellas County is also number 1 for vehicle versus pedestrian crashes in the state, and is in the top 4 in the nation for vehicle versus pedestrian crashes. We have a very high rate of teen auto theft, as I mentioned earlier, and a rising number of teens that are crashing cars, resulting in fatalities from auto theft. There is 137 documented crashes involving juvenile auto theft last year. Pinellas County is among the top 4 counties in the nation for vehicle versus pedestrian fatalities. Statistics show that females are more likely to be involved in a traffic crash that results in fatalities. But in those crashes, it is more likely that males die from the injuries in those crashes. There are many prevention campaigns going on right now to stop this increasing number of fatalities from vehicle crashes in Pinellas County. There's currently a burglary prevention campaign that's being put on by the Pinellas County Sheriff's Office deputies to prevent burglaries of cars. There's a texting and driving campaign. There are signs throughout the county that blink saying don't text and drive, and tell people reasons why texting and driving can cost them their life. There are seatbelt safety campaigns and car seat safety campaigns that are presented to the county by the Emergency Medical Services and paired with the Pinellas County Health Department. There are many assets in Pinellas County. To begin with, there are educational opportunities. There are remote university campuses in Pinellas County, such as University of South Florida, Stetson College, and Penn State, that provide the residents of Pinellas County the opportunity to attend out-of-state schools while still living at home. There's also a community college called St. Petersburg College that provides 11 campuses, and it provides associate's degrees, bachelor's degrees, and even certificates. There's a private college in Pinellas County called Eckerd College that brings people from out of state into Pinellas County. There's housing in Pinellas County for the homeless. We have a very large homeless population. The housing available to them are shelters, there are efficiencies, and there's transitional programs available through different churches in the county. There's 2 large shelters, Pinellas Hope and Pinellas Safe Harbor, that offer the homeless a place to stay and transitional housing programs for the homeless. There's also low-income housing available for families. There's rapid response emergency medical services in Pinellas County. The system is in place called a dual response system. This system involves making sure that a fire truck or an ambulance or both responds to all medical emergencies in the county and provides them service in under 10 minutes to get to a local hospital. There are many hospitals and freestanding emergency departments in Pinellas County. There's also many public health campaigns available in Pinellas County. There's public health campaigns to help out with the overall health, to help out with vaccination, to help out with teaching the community CPR. There's different campaigns throughout the county that reach out, especially to the areas of need, to try to teach people how to better health. There's beaches and parks and trails in Pinellas County. Over 70,000 people walk the Pinellas County Trail every single year to help with good health and recreation in Pinellas County. I have 3 programs that I'm going to recommend to help the overall health and the largest problems of health in Pinellas County. The first program is free and mobile vaccinations. A free and mobile vaccination program will be provided to the homeless residents of Pinellas County and those in the highest risk areas. Pinellas County Health Department currently offers a program that offers low price and free vaccinations. The free mobile vaccinations program would have this program go mobile to Pinellas Safe Harbor and Pinellas Hope and the surrounding area once a month to provide free vaccinations to those at highest risk. A ride-sharing program would be available. This would include subsidizing rides in taxi services and Uber and Lyft services that are already in Pinellas County. They would be subsidized only to the residents in the 5 highest zones to provide them transportation to get to school, work, and to grocery stores, since there's not very many grocery stores in those 5 areas. The final program is a graduated driver's licensing program. This is a bit harder, but is through the laws in the state of Florida. A graduated driver's licensing program would make it so that the residents in Florida, when they are of driving age, which is currently 15 years old, would have to go through a step-by-step process to get their full license. They would no longer be able to get a driver's permit at 15 and then get a driver's license at 16. They would have to get their permit and go through a step-by-step process, gaining privileges each year until they were 18 years old to get their full driver's license. This would provide them the opportunity to learn how to drive and have driving skills before they are fully cleared to drive. This program would be implemented to cut down on the fatalities of those under 25 in driving in the state of Florida. These are my recommendations to improve the overall health, minimize traffic crash fatalities, and teach the skills that you need. This would also provide ride sharing to get people where they need to go in those 5 zones to improve their health, and vaccinations to minimize the spread of hepatitis A, which is a current epidemic in Pinellas County. This is my assessment of Pinellas County. Thank you.